The Mental Capacity Act is a legal framework that's primary purpose is to safeguard decision making for vulnerable adults who may lack capacity to make a specific decision. It applies to adults over the age of 16 who may have an impairment of the mind or brain, whether that's a diagnosis of dementia, severe learning disabilities, or they could even be under the influence of drugs or alcohol. When assessing the Mental Capacity Act, it's really important that we remember that it is decision specific. For example, someone might have capacity to make a decision around what they eat that morning, or what they're wearing, or who they go to see, but they might have difficulties making a decision around a serious operation. The first principle of the Mental Capacity Act is assumption of capacity. We should not be assuming that someone lacks capacity. The second principle of the Mental Capacity Act is to take all possible steps to aid understanding in the decision being made. The third principle of the Mental Capacity Act is that people have a right to make unwise decisions. Just because that's a decision that you particularly wouldn't make or I particularly wouldn't make doesn't mean that that person lacks capacity. For example, if someone had a diagnosis of diabetes, let's say, and they understand the risks of that diabetes, of maybe making unwise food choices, but they still choose to have a Mars bar, that doesn't mean they lack capacity. They're understanding all that information. It's really important, if an individual is deemed as lacking capacity, that any decision that is then made is under their best interest. It's really important when we're looking at best interest decision making that we're also looking at the least restrictive option. For example, let's say someone's come in for their annual blood test and they found the blood test really difficult. A very restrictive and quite invasive option would to be putting them under sedation to take the blood test. It may be that we actually try using reasonable adjustments first, for example, going to the person's home to take the blood test. It may be that they need some blood test desensitisation work. They may need someone who knows them well with the blood test. They may need some more accessible information around the blood test. When completing a mental capacity assessment, there are two stages. So the first stage would be looking at whether the individual has an impairment of the mind or brain, whether that's permanent or temporarily, whether an individual understands the information, whether they can weigh up the information and the pros and cons, whether they can retain the information that has been given to them, and whether they can communicate their decision. That could be verbally, non-verbally, it could be pointing at a picture, a Makaton sign. And if we found that the individual does lack capacity, the first thing that we'll be asking ourselves is whether the decision can be delayed. Are they able to regain capacity? If the person lacks capacity and we need to be looking at a best interest decision, we need to be looking at completing that through a best interest decision meeting. When completing a best interest meeting, it's really important that people relevant to that individual are involved in the best interest meeting decision. That, for example, could be the GP, a family member, a carer, and if the individual doesn't have a family member, you may want to look at doing a referral to the independent mental capacity advocate.
I have called this best interest meeting after seeing Julia, who has Down syndrome and learning disabilities, for her annual health check. She has not had a blood test for 2 years. Due to weight gain and tiredness, I would like to rule out hyperthyroidism. Despite using accessible information, ensuring the environment was not noisy, and Julia's key worker supporting with communication, Julia did not understand the importance of the blood test.
Julia finds blood tests difficult. She had a successful one 2 years ago, but this was done at home.
I'm happy to go to the home. It may be a good idea to use Emla cream or a butterfly needle so it's not so painful. Dr. Long, could you prescribe a PRN like diazepam to use as required?
As Julia previously had a successful blood test without PRN, this should be used as a last resort. It is within her best interest to try the reasonable adjustments we've discussed first.
Julia attends a drama group on Wednesdays and Thursdays that she really enjoys. If she had to miss this, she would become upset and anxious due to the change in routine.
We can arrange for tests around her drama group. Sally, can you consent on Julia's behalf?
No, I can't do that.
Julia's key worker cannot consent on her behalf. We have completed a mental capacity assessment and have agreed a plan under best interest. Thank you, everyone.